has a capacity to hold a charge. But if you put metal in that tooth, you disturb this electronic flow. And so a whole vast of things are now being looked at related to this electrical disturbance that you make mention of, and rightly so.
As you can see in the X-ray, these teeth that are marked out are the ones that have silver fillings in them. Now they're as you can, we'll see just a bit in the mouth, they are decayed already. They started to leak, and these are full of bacteria. And the bacteria starts to fester in his mouth, and then it'll start to spread all through his whole body. So what we have here is, you can see, some of the mercury and amount and some of the silver filling in there that is oxidizing and it's seeping into the body. And if we have micro leakage, want to see how far you can jump? Okay. Well, in this area there, he's already got some micro leakage, and Clostridium bacteria is going under there, and it festers in there, and that creates, well, an infectious site. And if you have bacteria in there, it'll start to go down into your tooth, and that'll go into your blood system, and then it'll harbor somewhere and create a larger problem.
Like a tumor.
It could go into a tumor.
Why are no other dentists doing this type of extraction procedure?
Well, from what I've talked with Dr. Clark, her theory is not, well, it's not a theory, her method is not well received by mainstream dentistry or mainstream medicine. There's a lot of things that are not well seen by mainstream medical practice.
Why do you guys see it?
Well, the arguments that Dr. Clark told us were very convincing, and some of the things we have seen through her method are, well, they're very blatant. You can't really ignore them.
So you actually see the bacteria under the
Well, no,
tooth?
you don't see bacteria because bacteria is microscopic. But you see the benefits that it produces.
So you actually see patients getting well after the teeth are removed?
They're getting a lot better.
Well, we're talking in general today about controversial subjects, right? And certainly root canal fillings are extreme controversy. And there's been a lot of concerns about the root canal. And it's not just recent. Dr. Alfred Price really was one of the pioneers in the concern of root canals. He was a past president of the American Dental Association and a tremendous researcher and a humanitarian and a nutritionist. He said that basically what he had found in his early studies is that he would take an extracted root canal tooth and take some of that grindings and put it underneath the rabbit's ear, and he would find that if the patient, the donor from that tooth, let's say had a strep bacteria, that rabbit then would mimic or would develop the same kind of infection. So he found that there was bacteria present in a dead tooth living in the tubules themselves. A vital tooth, a healthy vital tooth, is made up of a canal on the inside with various blood vessels and nerves radiating inside the chamber of that tooth. And radiating from this canal are little tubules, microscopic little tubules in the dentin underneath this cap of enamel I mentioned earlier, that little tubules allow the fluid to come in and out of that tooth, balancing the hydrostatic pressure within that chamber. so that when there's swelling inside the tooth, we see a fluid coming out the tooth. Otherwise, we'd have a toothache all the time. So this exchange of fluids throughout the tubules in a healthy tooth is there for a reason. When we do a root canal filling, we take out all the canal, all the dead tissue. In the case of a dead tooth, we were to assume that if a tooth died, we would simply remove the nerves and the blood vessels and the abscess and all the dead tissue that was related to a dead tooth and fill it in with a suitable filling material. Now, assuming that filling material is suitable, Dr. Price showed that within these tubules that were once occupied by fluid, now they have become dehydrated, and then they become inhabited by microorganisms.
Why do you have to extract a root canal?
Because wherever there is foreign material in a tooth socket, which is way down deep in your tissue, Clostridium bacteria find that location and they grow there. So it isn't, in this case, a matter of what the composition is. It's the fact that it gets infected and you don't know it. You don't feel pain. You're not alerted to it. And the Clostridium bacteria find it a home because it's anaerobic.
What's the problem when people extract the teeth and they don't pull that ligament out?
Well, according to Dr. Clark, everything in this area has already been infected. And if you leave part of the tissue that's infected, it'll still fester in there. It'll still be contaminated. The reason for this is that although you do get a lot of bleeding, the bone in that area is not as, well, it doesn't have as much circulation because it's a thicker type of bone. It's more of a cortical type of bone that goes into that area. Now, this cortical bone is thicker, it's denser, so it has less circulation. And unless that is scraped off accordingly, and some of that bone that seems to be contaminated, taken out, so we leave a nice big bloody mess.
An open cavity so it can heal better.
So it'll heal better.
And this is what she calls the Archega method in her new book.
I haven't read her new book yet.
Look at that, Chris.
This is how far.
Look at that bacteria.
Bacteria of the black.
All that black. There's what.
Hold it, see that?
Gosh, look how poisonous that is.
Wow.
See below the
I put in your mouth pieces of grass.
I'll do that.
Okay.
I'm now 37 years old, and I've had these fillings since I was 13, and I've constantly been fighting with an immune system breakdown, and I've always had little growths growing in my lymph system, and most recently I've had this tumor on my breast, and I couldn't get it to go away, constantly fighting with bacteria growing there, specifically the Clostridium. So after consulting with Dr. Clark, she said the only thing to do is to really pull the teeth. The fillings were so big that I couldn't risk trying to drill them out and poison myself with even the slightest amount of the mercury. And now that we can see what actually came out, it was even more toxic than we thought. And to be honest with you, I think this procedure was actually easier than going in with a drill and drilling and trying to replace the filling. And to date, there really isn't anything to replace the fillings with that isn't toxic. So for the sake of saving my life, I think this was a much better procedure. And I'll just get some partials and put them back there and continue on with my healthy lifestyle. So all this research that you've done over this past number of years, you funded yourself?
Yes.
And in doing so, how were you compensated?
By the knowledge, I suppose.
So you do this out of the goodness of your heart, not looking for compensation financially, but you have a true passion for finding the cure to all disease.
Well, at least cancer and AIDS.
Again,
I can't cope with all the rest of it. Others will, now that we have a technology that can do it. but I thought that I should be focused on cancer and AIDS since there is so much suffering there.